It was a humid morning in Léopoldville when a thin, faded vial, drawn from a patient in 1959 and shelved through decades of colonial tumult, would one day rewrite the story of a global pandemic. This is not a tale of sudden revelation, but of slow forensic discovery. In 1983, in a cramped laboratory at the Pasteur Institute in Paris, Françoise Barré-Sinoussi and Luc Montagnier isolated a previously unknown retrovirus from a sick patient. They named it LAV. Across the Atlantic, Robert Gallow's laboratory in the United States isolated what they called HTLV3. The race to identify the cause of the fledgling AIDS crisis became political, international, and bitter. Did the world finally have the culprit? Or had science become another theater for national pride? The tension hardened into accusation. French scientists protested that American labs had used their samples. The Americans countered that they had independently grown the virus. Headlines framed the fight as a theft of discovery. Behind the drama lay something larger: the urgent need for a test, for credibility, for the money and infrastructure to battle a disease that was already ravaging communities from New York to Kinshasa. Meanwhile, researchers turned to Africa's past to understand how this virus emerged. The vial from 1959, taken from a man in Léopoldville, the city that would become Kinshasa, was analyzed decades later. Molecular sleuthing showed HIV-1 already present in Central Africa long before AIDS was recognized in the West. Genetic clockwork, comparing viral sequences, pushed the virus's common ancestor back to the early 20th century. Kinshasa, then a booming colonial transport hub with rail lines, river traffic, and a growing commercial sex trade, became the crucible where a chimpanzee virus, likely from bushmeat in what is now southeastern Cameroon, took hold in humans and spread. Discovery created questions, and questions bred conspiracies. Some charged that a vaccine, program, or laboratory experiment had unleashed HIV, the most persistent being Edward Hooper's claim, in the river, that contaminated polio vaccines used in Africa had sparked the epidemic. Others whispered darker plots: biological warfare, deliberate release. The Gallo-Pasteur dispute added fuel. If laboratories scrambled for credit, might there be more sinister tampering behind the scenes? Science pushed back. Archived vaccine samples were tested and found unconnected to HIV. Genetic analyses traced HIV-1's ancestry to a non-human simian virus, not to vaccine stocks. Independent sequencing showed how viral lineages expanded with urbanization, unsterile medical practices, and population movements, mundane drivers, not conspiratorial design. In 1987, after years of legal and diplomatic wrangling, the US and French institutes reached a settlement acknowledging shared credit and the origins of the diagnostic test. In 2008, the Nobel Prize honored Montagnier and Barré-Sinoussi for their isolation of the virus. Recognition that finally settled, for history, part of the earlier dispute. The discovery and its messy aftermath reveal more than scientific sleuthing. They show how colonial histories, public health gaps, and human mobility transform a single zoonotic spillover into a pandemic. They show how scientific rivalry can become public drama, feeding conspiracy when fear and ignorance are the currency of the day. Today, the 1959 vial and the work that followed stand as a forensic archive. A reminder that pathogens have histories rooted in places, politics, and poverty. The conspiracies that sprang up in those panicked years were real social forces, narratives people used to make sense of suffering. They were disproven not by declarations, but by patient cross-continental science, sequencing, sample testing, and epidemiology. The story that began on that humid morning in Léopoldville is still unfolding. From the courtyards of Central Africa to laboratories in Paris and Maryland, the discovery of HIV reshaped science, policy, and lives. It forced ruthless honesty about how diseases travel and what society must do to stop them. The truth, when finally reconstructed, was less dramatic than many conspiracies, but infinitely more important. An ecological spillover amplified by inequity, slowed by science, and confronted by humanity's determination to understand and to heal.